It's Patrick Christie's Tonight on GB News. It's time now for our head-to-head. Yes, OK, so the dust had barely settled on the shock news yesterday that King Charles's cancer diagnosis had hit, but self-titled anarchist and academic Lisa McKenzie took to Twitter to gripe, "What an insult to all of us that the King can get an immediate diagnosis and treatment for cancer while people sit and suffer on NHS waiting lists for years." Her tweet received a swift backlash, with Conservative commentator Chris Rose pointing out if King Charles did pointlessly add extra demand on the NHS waiting list by joining it, the same tedious people would complain about him taking up a bed in the NHS. Indeed, the NHS aims to start treating cancer patients at least 2 months after their diagnosis, but in 2023, only 59% of NHS patients met this target. Yet those with private healthcare, like the King, can go from diagnosis to treatment in a matter of days. So tonight I am asking, is King Charles wrong to jump the NHS waiting list queue? Let me know your thoughts. Email me gbviews@gbnews.com. Tweet me at gbnews while you're there. Go and vote in our poll. I'll bring you the results in a few short minutes. But going head-to-head on this are sociologist Dr. Lisa McKenzie, whose tweet has caused all of this controversy, and former Health Minister and Conservative MP Edwina Currie. Lisa, I've got to ask, do you think your tweet was vile?
No, I think it was honest. I think it was true, and I think it was honest. And yeah, I did notice that straight away lots of sort of Conservative and Royalists sort of jumped on it. But also, there's been a lot of people who kind of agreed with me as well. I've been doing a bit of a poll myself today, doing a bit of canvassing and asking people in my community, in a mining community in Nottinghamshire, what do you think about this? And people in my community in Nottinghamshire, most of which watch this programme, are telling me that actually they agree with me. And it's annoying that, you know,
all right.
It's not so much that he's jumping the queue, because, you know, no one ever expected him to go to the NHS, phoning up at 8 o'clock every morning to get an appointment. No one thinks that was going to happen. But what it has done is shown just how unfair and unequal the country is.
OK. All right, I'll come back to you. Edwina, your views on this? I mean, what Lisa is saying there is that plenty of GB News viewers in Nottingham think that she's absolutely right.
Well, maybe she should just campaign to see some improvements in the NHS and her colleagues and friends who work for it in her area. I think she said Nottinghamshire, not Nottingham. Nottingham is famous for its wonderful teaching hospitals there. Funny enough, this morning, as I was trying to take the boys to school, there was an emergency ambulance at my next-door neighbour's taking her to hospital. The NHS is run extremely well in many, many parts of the country. We all want it to be better. As for the King, you know, to be quite honest, if he can afford to pay for it, that's fine. That's absolutely fine. And what is Lisa saying? Is she saying that health insurance is wrong, that employers shouldn't be giving health insurance, that they should never have a clinic within their workplace, that we should somehow discourage people from doing anything that isn't the NHS? I mean, that would be a nonsense. That would put, Chris Rose is right, it would put an enormous additional burden on the NHS, which it doesn't need and isn't coping with now. And if people can afford to pay for their care, that's fine by me.
It's not just affording to pay for it. I mean, Lisa, King Charles probably pays for loads of nurses and loads of doctors, voluntarily pays income tax, has done, I believe, since 1993. You know, so, look, he's paying for the NHS, so now he's freeing up a bed for somebody else. What's the problem?
Oh, that's a poor argument that King Charles pays his tax. We all pay our taxes.
Well, he pays more, though, doesn't he?
No, he's paying directly to the hospital. Those bills are paid for.
Yes, he is. Yes, he is. And do I have a problem with a two-tier hospital system where people who are wealthy get better treatment? Absolutely, I do. And I think most people in this country do agree with me that you are right, Edwina. The hospital, our NHS, and the health system has to be better. You're right. I agree with you on that. I used to actually teach at the teaching hospital in Nottingham that you're talking at. I taught nurses how to research. So I know
maybe you should go back to it and do it again, and that way you'll be able to help and raise the standards. We have excellent NHS. I live on the other side of the country, up near Manchester. My husband had cancer 3 different times in 9 years. He was treated at Christie. He was treated at Wythenshawe, which is the University Hospital of South Manchester, and at Macclesfield Hospital. They were all absolutely superb. We have excellent NHS, and they give the best kind of cancer treatment that you'll get in many parts of Europe. So I think we should be very grateful, and I think people like you should stop being an influencer and go back and help teach there and help work there.
All right, Lisa, go on.
Nobody's influenced by me. But let me just go back to that. So you said that you knew people who'd been treated in Manchester. Well, there was a report done, and it was in the Lancet last year, which actually said that in the lower socio-economic areas in the UK, that actually in some areas of the UK, the wealthier areas, cancer treatment and actually survival is rising. So you're absolutely right. Cancer treatment in some areas are rising, but not in the poorest socioeconomic areas. They're actually dropping, and in unbelievable rates. Manchester is one of those places. Liverpool, where you're from, is one of those places. Well, I've got
Lisa, could I ask, Lisa?
It's not true. You're way out of date. And I can tell you exactly for why. Because in the Northwest in particular, they had a long, hard look at cancer treatment, why the rates of success were so poor. And they found it was not because of delay in the pattern of treatment. It was because the tradition was you come in a fortnight, you have your test.
Now, I just want to veer us.
You come in a fortnight, you have another test.
I want to veer us back onto the king.
So they started doing everything all at once. It got very hard work to do it, but they managed to do it. They saved my husband 3 times. And I am very grateful.
Look, I just want to veer us back to the king. Now, I can't really believe I'm asking an anarchist this, Lisa, to be fair. But, I mean, this guy is the king, all right? This guy is the king. Does he not deserve the very best of the best? No. The amount of stuff he's done for this country, the amount of good causes he's raised money for. You know, what have you done?
What have I done? What do you mean, what does he do? His job is waving and shaking hands. And now he doesn't have to do that for a few weeks, when there are people all over the country who've got very serious illnesses that have to work. And the thing that has annoyed me the most about King Charles, and then I'll let Edwina sort of do what she does best, is his statement has been he wants to share this with the public because he wants the public to know that he feels some sort of connection with those who have cancer. He has no connection with most of the people in this country at all, in any single way.
Lisa. It's a bit insensitive, this. It's a massive... It's a relatability thing. I mean, Edwina, I'm just going to ask you a very straight question. Now, as the king, do you think he should get the very best of everything at all times? Should he get absolute priority, complete treatment, even if that means, you know, someone misses out on their specialist because that specialist has now gone to the king?
That's 2 different questions. Should he get the best of everything? Yes. Should he have priority? No. We should all get the best of everything as far as we possibly can. We should always work and pay our taxes to ensure that the NHS is as good as it gets. But those of us who can afford to pay, in circumstances where that's appropriate, let's see that happen. And the NHS, of course, does actually pay to send people to private hospitals that Lisa would probably shut down in order to reduce the waiting list. I've got members of the family where that's happened as well.
I wouldn't shut those down.
All right.
I would never. Why would I shut a hospital down?
Fine. We're going to have to park it there. We're going to have to park it there. Look, thank you. Thank you very much. I enjoyed it anyway, very much both sides of it. That is the sociologist, Dr. Lisa McKenzie, and former Health Minister Conservative MP, Edwina Currie. Look, who do you agree with? Criticism online, is King Charles wrong to jump the NHS waiting queue? David says, if he went to an NHS hospital, the same people would complain about him taking up a bed. Exactly. Andy says, why would anyone queue if they didn't have to? I wouldn't. I don't know anyone who'd choose to queue if there was another option. Your verdict is now in. So, 35% of you agree that King Charles was wrong to jump the queue. 65% of you say that he wasn't. And I am very much in that 65% for what it's worth.